Welcome to the Therapist Thrival Guide. My name is Miranda, and I'm here with Emily today. Emily, can you go ahead and introduce yourself?
Yeah, I'm Emily Turcotte, and I've been a therapist for about 16 years. And I am most recently at LE in Manchester, New Hampshire.
Awesome. Emily, tell me a little bit about like your specialties and what sort of modalities you work from.
So I work a lot with trauma, anxiety, depression, some bipolar, um, and kind of things that we run into with that, like sleeplessness, insomnia. Um, Yeah, whole variety there. Um,
Yeah.
and I work a lot with DBT, dialectical behavior therapy, CBT, so cognitive behavior therapy, and then I'm kind of eclectic. So it depends on what the person needs and what we're looking at.
Awesome. Awesome. I am so excited to talk to you today. This is like a perfect transition into our topic. We are talking all about insomnia. And this was something that came up recently because I was seeing clients back to back one day. And every single client I was working with that day was like, "Oh, I've been dealing with sleeplessness. I've been having trouble with this and this." And I do work with quite a few clients who have been through trauma, have various personality disorders, all the things. But I was just thinking to myself, like, so this is such a common symptom that clients have that I feel like I feel like I don't talk about it a lot, and I also want to learn more about how to treat insomnia, how to help clients who are dealing with sleeplessness, and so I'm thrilled to have you on here to talk more about this. Curious if we can just kind of like start at the super, super, super basics. Um, what is insomnia and like who do you typically see dealing with insomnia?
So insomnia is when we have trouble sleeping, whether that's falling asleep, staying asleep, or waking up early. It can happen so often, and often I see the chronic nature. So just like over and over and over and over, having this. So maybe not like once or
Mhm,
twice, once in a while, but like a long time, repetitive.
mhm.
Maybe, weeks or months in a row with maybe a couple nights of reprieve.
Yeah,
And then I see it a lot with depression, but also anxiety, and PTSD. um, for sure. So that either those thoughts are spinning, keeping them awake,
mhm.
or it's nightmares that wake them up in the middle of the night, um, or just kind of a combination of their body being on alert.
Mhm. Yeah, I'm glad you talked about kind of like the chronic nature of this because I was going to use the example of my family and I were out of town this weekend and we stayed in an Airbnb and the Airbnb had the softest mattress I've ever had in my whole life and like both my husband and I were like we can't sleep on this mattress and we just like couldn't sleep. Does that mean that we had insomnia? No. I mean, I guess we had a hard time sleeping, but it's not something that is really at the same level, right? It's like when we talk about insomnia in this context, we're talking about our bodies being on alert, exactly what you were saying, where it's like maybe physically we can't fall asleep because our minds are spinning or there's other factors. But do you see people who have depression, anxiety, and trauma suffer from the same kind of in- insomnia, or do you feel like it's kind of different for different diagnoses?
Mm. I would say it's different for different diagnoses. There can definitely be similarities of like someone suddenly waking up in the middle of the night and then their thoughts start racing, like with anxiety. But
Mm,
it could also be that they suddenly wake up in the middle of the night because they had a nightmare related to some trauma, and then that keeps them awake because they've just been jolted awake by whatever horrifying thing they've relived.
yeah. I mean, when you are do you see certain things that might trigger insomnia, or is it kind of, like, unrelated? I guess I'm just thinking through, like, what for PTSD in
Mhm.
particular.
I think it can vary, depending on what the trauma is. I know for a lot of my folks with trauma, it is nightmares about past stuff that wake them up all of a sudden.
Mm-hmm.
Um, for other folks, it's they're just awake, like at a certain
Right.
time. Could be like 3 o'clock. And they're
Mm-hmm.
like, I'm awake. What time is it? Is it 3? Yes, it's 3.
Interesting. So it's like clockwork. It just happens over and over for them.
Yeah.
Interesting. What do you feel like is part of the issue for, I mean, I can see how, like, as someone who has been anxious, like, I can see, how you would lay in bed and have spiraling thoughts, but what do you find is kind of, like, behind some of the insomnia for people who have depression?
Yeah. So I think for like often with people with depression, we think of them as people who like oversleep and
Mhm.
just are
Right.
like maybe sleeping 12 hours at a time, or they
Yeah.
get up, do their day and take a nap, or, take a nap in the evening or go to bed super early and like sleep the whole night.
Oh,
But
sure.
it can also be that they wake up. Um, they aren't able to sleep well, and so they sleep fitfully. So maybe for a couple of hours, and they wake up in the middle of the night, and then they're just up for a bit, and then go back to bed, um, and just kind of off and on like that.
Sure,
So
sure.
I've definitely seen that with them as well.
I have a couple of different clients who have dealt with insomnia for a variety of different reasons. I have a kid that I've worked with in the past who just would, lay in bed all night and do this thing where they watch their clock, they just watch the minutes go by, and then they start to get more and more anxious, thinking,
Mhm.
I'm only gonna get 6 hours of sleep now, or I'm only gonna get 7 hours of sleep now. And kind of uh freak themselves out in that way, but then a lot of their insomnia is also related to school, and so it's like they wouldn't
Mhm.
necessarily have as many sleep issues, on the weekends or in summertime, but during the school year, oftentimes their insomnia is related to, like, thinking about their different assignments, making sure that they don't oversleep, a lot of, like, social anxiety, things like that, and for that particular kid, we've talked a lot about bedtime routines. We've talked about, like, ways that they can be coping with some of the core issues around their anxiety. But I'm
Mhm.
curious, like, how you would approach, helping somebody whose kind of root of the issue is more around, like, anxiety and having trouble sleeping because of those spiraling thoughts.
Yeah. So even if anxiety is like the main thing that is happening, and especially if they're an adult, I tend to want to make sure they have a sleep study first,
Oh, interesting.
because sometimes they can have, sleep apnea or other sleep issues on top of
Great point.
their stuff. So I want to rule out anything medical
Mhm.
and do that first. So depending on how that comes back, might change what we do, um, or it might be in conjunction with. Uh, so there's a couple things from DBT that I like to do with people. They're in the emotion regulation unit. So if you think of like the 4 units, um, with interpersonal effectiveness, emotion regulation, distress tolerance, and mindfulness. This is in the emotion regulation unit. And the first is the nightmare protocol. So if it's a nightmare, that's a great one to utilize, just to give them something concrete to use. The other one goes through every checklist. So the person that you're talking about, you might have gone through everything on the checklist. Um, but so it tends to have things like, um, to increase the likelihood of restfulness and sleep, do this. If you are calm but wide awake, do this. If you are anxious or
Oh.
ruminating, do this. Um,
Wait, wait,
so
wait.
if
So what are some of the examples? I'm curious. Like, if you're someone who's anxious and ruminating, what does
Mhm.
DBT say to do?
So the first one it lists is to use the cold water and the tip skill. So the tip skill is tipping the temperature, intense exercise, and paced breathing or paired muscle relaxation. And so it's saying use the T part, tip,
Mm.
the temperature. So we're changing that. So it says use that, and then get right back in bed and do the paced breathing. So
Interesting.
that can
Yeah.
be something to kind of like spike that and then bring it back down. You can do a meditation practice, which is also helpful. You can also focus on bodily sensation of the rumination. So it says rumination is often an escape from a difficult emotional sensation. So, what is it in the body that you're feeling? Where are you feeling it? How much are you feeling it? Um, what's going on? I'm trying to
Mhm.
listen to those things. Um, so, focusing on that, and maybe write some notes for your therapist so that we can know what you're experiencing and how to kind of handle that. Um, Reassure yourself that worries in the middle of the night are just worries in the middle of the night. I always tell people like your worst thinking is right before bed.
So
And
true.
it
Mhm.
seems so much worse than it is, right? Um, and usually you wake up in the morning and you're like, that wasn't so bad, actually. So I think like just remembering that perspective of like, okay, I'm just having that stinking thinking before bed,
Right.
so to speak. And then you can read an emotionally engrossing novel. And if that doesn't stop, if the rumination still doesn't stop, it's like, okay, are there things that you can solve? If you can't solve them, then let them be and kind
Mhm.
of practice that radical acceptance of like, okay, these are things I can't fix right now. And I'm just going
Mhm.
to have to give them some distance. I know, easier said than done sometimes, but
This is so good. I am such a DBT newbie, and I had no idea that it actually had, like, a protocol around this, and so this is really helpful. What are some other is there maybe, like, one other that we could kind of go through how DBT would say to deal with it? If it's, like, has to do with anxiety, or what were some of the other ones in there?
yeah. Well, let's see. What I think is the funniest. So I think a lot of times DBT encourages us to use like sensory things. So whether we're seeing something, hearing something, using our
Mhm.
touch, taste, like whatever it may be, to kind of like fully integrate that self and bring ourselves into the present. And one of the things it says very last is if you uh, if there's nothing else that works, lay down, close your eyes, and listen to some NPR.
Oh, that's so funny.
And it's because they have the very calm
They
voice.
do,
It's very
yes.
consistent. Like you're not gonna
Mhm.
have the sudden jump of like even the commercials are very like, you know, very
It
calm.
really says that. It says, like, "This is if none of this works, just lay down and listen to
Yep.
NPR." Oh,
Yep.
that's so funny.
BBC, NPR, something at
Mhm.
low volume just to kind of
Yeah.
drown out that like thinking that happens.
Yeah. You're,
So
like,
it can just
giving
kind
your
of,
mind a distraction. Mhm.
yeah. So it kind of does that auditory thing of like,
Yeah.
okay, let's use that. What can be distracting? Because I mean, if we're listening to music that we love, we're going to be totally engrossed in that. Um, so I
Yeah.
think it's, trying to find something like the most innocuous that
Mhm.
is kind of in the background, blocking out these other things.
I love that. That's awesome. So we talked about, like, rumination. Um, what would DBT say if you were, like, spiraling and your thoughts were kind of, like, going all over the place and you couldn't sleep? Does it have, like, a protocol or tips for what to do in that scenario?
So I would kind of consider it similar to the rumination, just the tips
Sure.
for that. So
Mhm.
you might use the tip scale again and use that temperature portion. If it's right before bed, like, doing some exercise isn't going to be relaxing. Um,
Sure.
but if you've been laying there for a while, it
Mhm.
might be something that kind of works out some of that energy. Um, so I think there's that
Sure.
piece. And then the the pace breathing, paired muscle relaxation, that can be helpful. So in the paired one, I used to always think like, oh, pairs, like I have two hands, two legs, pairs of things, right?
Oh, yeah.
And actually, it's pairing. phrases that are positive. So kind of like cheerleading
Oh,
statements, so to
yeah.
speak. And like, so breathing in, like, I am capable, breathing out, I'm letting this go.
Mhm,
Um, or I can sleep, I can let this go, something
mhm.
like that. And maybe that's something, the phrase you might think of with your therapist or something like that. But so you're kind of pairing those positive phrases with the breath, um, in and out, which I hadn't considered before. I just thought,
Yeah,
oh,
I love that.
pairs. I have pairs of appendages.
Oh, funny. No, I like that a lot. I think that, like, for so many of particularly, like, my younger clients who struggle with insomnia, it's really helpful for them to have, like, a go-to, list of things to try, as well as, like, things to say to themselves to reassure themselves. Like, the example that I gave earlier, the client who just
Mhm.
watches the clock all the time, um, trying to get her to a point where she can, reassure herself that I will get plenty of sleep. I will be well rested in the morning. And for her, I was using the example of we have all been we have all been in the scenario where we are like really, really excited for a vacation or really, really excited for something in the morning. Maybe it's like, I don't know, Christmas morning, or have to get to the airport super early. And a lot of times in those scenarios, we don't get enough sleep. We like, we'll stay up late packing, and then we have to wake up really early to get to the airport. But I never have I ever been like dreading, like I lay in bed and I'm like, oh man, I just need to fall asleep. It'll be okay. And there's something about like, even when I'm running on a short amount of sleep on those days, like, it all ends up okay and it all turns out okay. And so even just trying to think of times where I have I've been running on 4 hours of sleep or something and I've been fine. And so, using that scenario or using that example and then trying to help them come up with, times there where they've been through this before and they've been fine, or times where they've been able to reassure themselves by saying like, it'll be okay. I'll have enough sleep. I can take a nap later in the afternoon. I remember when my son was first born and I was not sleeping through the night, I would like promise myself that I could take a nap later in the day, and that would like
Mm.
help me get through the falling asleep, or the things we say to ourselves when we can't sleep.
Right.
Um but what can you think of anything else that might be helpful for people specifically that are struggling with anxiety and insomnia before we kind of switch gears to another topic?
Mhm. So one of the things I also think about is like similar to what you said, which is at the end of the day, it's rest. You might not be asleep actually, but let's just lay in bed. So I don't know about you, but my mom would always say to me, you don't need to take the nap anymore, but you need to stay in your room. So kind of similar to that. Like I can lay here in bed and it doesn't mean that um, I need to be asleep, but I need to lay here and rest my body. Um, and hopefully our minds will be rested too by that point, but it might not. Um,
No, I love that. True.
but specifically for anxiety, I think kind of two things. One is sometimes writing those thoughts to have them outside of yourself as a way to get them out can be a way of getting them out. But I would
Are you
say don't
talking
read.
about, like, journaling or, like, a mind dump exercise or something like that?
Just like, so say it's ruminating thoughts or something like
Mhm.
that. I would say just write what those are, but
Oh,
don't read
okay.
them again. Don't read them again.
Yeah.
You're just writing
Mhm.
purely to get them out in another way.
Mhm.
So I would do that. And then if it's not helpful to write them, like sometimes you need to shred them afterwards because you just can't help but read them again.
Mhm.
So that's what I usually tell people
That's a
to try.
great example. Yeah, I mean, I have clients often do, like, mind dump exercise, or we'll, like, talk about the benefits of journaling and how oftentimes our minds spiral or, like, continue reprocessing or ruminating on the same thing just because it's almost like it wants to make sure we don't forget it, or it wants to make sure that we do it, or it feels like it hasn't been processed enough. And how oftentimes just the act of writing it down almost gives our mind permission to be like, all right, the paper's got it. It's you're not going to forget it. We will figure this out
Yeah.
tomorrow. It's almost like a permission to like let it go, at least for the time being, because it's on the piece of paper. We're not going to forget it or something like that. And so I find that to be really helpful.
Yeah, especially the to-do list items.
Yeah.
Sometimes I say keep 2 things, one a to-do list and one a journal. And if it's a
Mhm.
to-do thing, put it on your to-do, and then you can say, "You know what? We got that for tomorrow."
Yeah.
Or if it's just like, "I need to brain dump," then brain dump.
Mhm. Mhm. Nope, that's great. Okay, so what about for clients who are having nightmares? What do we do to help clients that are dealing with nightmares?
Yeah, so I think they're such a challenge, and usually they go on and on for a long time. The nightmares, not the not the client. Um, and I think they really stick with people, and sometimes they're repetitive or they're like different aspects. One of the sheets I go with first is a sheet from DBT also, which is the nightmare protocol. And um, so there's a few different steps that it has. One is practicing relaxation, pleasant imagery, and coping skills first. So this is you're trying to change the nightmare that you're having to maybe be a neutral mirror, or like even something positive, just a better dream. So first, you're practicing all those things. It really helps to do relaxation before you go to bed. Then you can choose a nightmare that you want to work on, write that down, and then write down an alternative ending or like just before it turns bad. Like sometimes, it's like okay, and then it suddenly takes a turn. So changing it before it gets to that turn so it never gets there.
I love that
And
idea.
and
Yeah.
then you just kind of repeat it
Mhm.
before bed.
Repeat the
And
nightmare or what do you repeat?
the new one, the rewritten one.
Yes, okay.
Yeah. And then over time it should change what's
Hmm,
happening.
interesting. I have a client who has been through a lot of trauma and has very frequent nightmares, and um she almost has like accepted it as like this is just a part of my life. Like I just can't sleep. I just have really bad nightmares all the time. Um and I wonder if this would be a good way to approach it for her because she really likes writing too. And so would you have her do that in session though? Like what would as like her therapist, would you be like, "All right, today we're going to work on nightmares. I want to have you write down the most like recent nightmare that you've had," or would you have her do that on her own?
So I would do it with just to one, make sure that it is that we're changing it before it does that sudden turn to something
Yeah.
terrible.
Mhm.
And then two, just to have that support of like, because I think those dreams can be so overwhelming
Oh
and
yeah.
they tend to take over. I mean,
Mhm.
they're their worst nightmares, literally.
Mhm.
So I think it just helps to have that support. So if
Yeah.
some suddenly something just comes off the rails, you can be there to help support.
Mhm.
Um,
Mhm.
Not that they can't do, but I think it's like teaching them that piece by going through it first.
Yeah. So you would say, "All right, I want to have you write down, the nightmare that you had last night, but right before right before it gets to this point or right before it gets to that point, I want you to come up with an alternative ending." Is kind of how you would do it. Okay. I like
Mhm.
that. Nice. Is there more to the nightmare protocol?
So you would rehearse and relax before bed every day, but also you would continue to work on relaxing during the day as well. So overall, you're trying to reduce your overall anxiety.
Mm,
Um, I generally think of regular dreams, so not nightmares. I think of them as um, moments. Either we're taking emotionally from the day with us. And so if we can change a little bit how we're feeling during the day by like trying to relax and having more
mhm.
moments of relaxation,
Sure.
that can really affect us when we sleep too. So
Mhm.
that will hopefully change it for the positive. that we can sleep better as well.
Yeah, that's great. What about if your nightmares or if their nightmares are directly related to trauma that they've been through? Would you approach it differently, or would you kind of like try to almost target the trauma first and see if the symptom, like the nightmare symptoms, subsist or persist?
Yeah, I mean, always, working on the trauma piece for sure and seeing where that gets us, but maybe also combined with that, trying to change some of the nightmare piece, especially if it's continuing to be as they work on their trauma, because often they get activated and it feels worse at first, right? Um, but that's kind of our brain of like reprocessing. So I might give them a little bit. Um, and that little bit might depends on what they're doing. So it could be a month or two, it could be more. Just trying to um, work on the trauma overall, see where we're getting, and if the nightmares are still really interfering, like targeting those more specifically.
That makes a lot of sense because I think that several of my clients who have been through very specific trauma, they are very hesitant to really like deal with some of the trauma in therapy because they're worried that the nightmares will get worse, or they're worried that how it's going to affect them. And
Mhm.
so um it does make sense that like, I mean, you can be dealing with both at the same time or even just trying to target the nightmares separately. I think that makes sense. How else would you kind of help clients who are dealing with maybe an insomnia due to PTSD? Is there anything differently you would do?
So I think in general, there's the CBTI, which targets CBT with insomnia. So it's looking at the thoughts that are reinforcing to the insomnia and trying to
Mm,
change that and rephrase that. I am not trained specifically in it. There is a protocol for it. I have not done that, but I do know it's out there and it's been helpful for some people. And I want to
mhm.
say like the VA has also done some work with that.
Oh,
Um,
sure.
and there's an app, I think, CBTI. Um,
Oh.
so just, kind of exploring that some more. I
Mhm,
think there are, recurring thoughts that keep us awake as well. So it's
mhm,
almost like changing those and having some reframes that we can have to kind of read over before we go to bed, similar to
mhm.
preparing and relaxing before bed.
Yeah. What can you walk me through? I mean, I know you're not trained in CBTI, but like what some of those thoughts might be, or like what some of those things might be that you would target with CBTI?
Yeah, so if I think of thoughts that keep people awake, it's the
Mhm,
staring at the clock, right?
mhm.
Like, ugh, now it's even later. I'm not going to get enough sleep, and I really need to sleep because I have work or I have a test
Yeah.
or I
Mhm.
have something tomorrow. So kind of those thoughts of like the panic of not sleeping.
Yeah. Mhm.
So there's that piece. Um, I think there's also um, uh, the worry thoughts. So either worrying about the next day, not necessarily that they can't sleep, but worrying about what's going to happen the next day or the next
Yeah.
few days. Sometimes it's replaying what is like you had mentioned earlier. Sometimes it's
Mhm.
replaying what happened during the day. So kind of targeting those as well,
Mm.
and reframing and thinking of some strategies to manage those.
Yeah, that makes sense. Any other last things that you feel like we haven't touched on when it comes to treating insomnia?
Um, I think sometimes people want a thing that's gonna work, like, right away,
Mhm,
and this can work, but it does take some time and practice, and so just continuing to kind of commit to that time, and doing the practice, that will
mhm,
get them so far, and that will help so
mm.
much. So I think just continuing to keep at it even when it's frustrating and maybe you've had it for a long time.
Yeah, yeah. No, this has been so helpful. Okay, I thought of one other random question.
Okay.
How would you help people who are kind of just like randomly waking up at night or waking up super, super early and maybe aren't necessarily having a hard time falling asleep, but it's almost like their body just like wakes up frequently at night. Would you approach that any differently than what we've talked about so far?
So I'd still be talking about the relaxation strategies. I'd also want to make sure that medically they're checked out because
Mhm.
sometimes there's things that wake us in the middle of the night that are that indicate medical issues.
Mm,
So that could be something. Also, if there's alcohol or substance use before bed,
that's true.
oftentimes that will wake us up early or keep us waking up in
Mhm.
the middle of the night several times.
Yeah,
So just keeping that in mind as well.
awesome. Well, this has been so good. Thank you so much for joining, Emily. This has been awesome, and I have I mean, selfishly have appreciated walking through some of my cases too with you and thinking like how to help some of my clients to deal with some of this. So I hope that this has been helpful for others. If you have not already, please be sure to subscribe to our YouTube channel, subscribe to us on Spotify, Apple, wherever you listen to your playlists or wherever you listen to your podcasts. And we'll see you next week. Thanks again, Emily.
Thank you. It was fun.